think what we have translated into, or what any institutions are looking for, is that you have the best AI platform that not only translates into one disease state but across the disease spectrum. That makes adaptation easier, that makes the clinical workflow easier. Once you start seeing the positive impact that comes out of using an AI, I think then it kind of creates a positive loop effect that will help us engage more and more investment into AI, as any health system would do. Because ultimately the goal is that if you can improve patient flow, patient outcome, disease detection, treatment, and triaging, which is essentially of what we want to provide as healthcare providers, I think adaptation of AI comes into much easier terms compared to just saying this is an AI, it's great. Because of the Aidoc, we had a patient at our sister clinical site which we thought that patient was sick. So even though I was not even involved with the patient, scan popped up and I looked at the scan and I was like, oh, this patient needs to be at an expert center brought in at Temple main campus from our sister hospital right away. So even before seeing the patient, we were able to triage the patient. So instead of physicians from the other hospital reaching out, we reached out to them and said, hey, let's bring this patient over because this patient appears sick. So the patient, we actually had a time to plan that this sick patient is coming to Temple Health System, unless a lot of times people just show up and then we decide, oh my god, this is way sicker than we thought. In this case, we had a chance at a midnight where we could review the images before the patient actually got transferred. Our interventionist, our intensivist, our ER physician, we all had a preliminary plan what to do this patient when the patient comes in. So that's huge, because the upfront time that you save for the PE patient is what that determines the ultimate outcome. So we are prepared for this patient. I don't think I could have thought or could have been like that 5 years ago, right? When that patient landed, right, we had time